So the program's funded by West Virginia State Legislature, grants and contributions from healthcare companies. So they've helped us with this. So when they developed the program, they realized certain things about this population of people. And so based on what they realized, they developed the programming for educational sessions. It started off with like 9 components of education that we started with in a classroom setting, kind of through 9 individual nights. Okay, so that's how it started. So we gave them information on the legality of what the position they're in, navigating the school system, health, nutrition, stress management. We know that grandparents that are raising grandchildren right now have at least one chronic health condition, more closer to 5. So when you think about it, raising children, they're a joy, but there is stress. And that manifests itself mentally, emotionally, physically. Raising grandchildren at a different time in their life. Things change. Things change yearly with, you think about social media. So parenting, kind of the same thing. So that was one component of it. Follow-up to that was 3 months of social work. So, and what that meant to me is, what are your challenges as you face this position you're in of raising grandchildren? So do you have economic challenges? Do you have legal challenges? Do you have, one of the big things that we'll get into is the reason in West Virginia, not the sole reason, but can be the opioid problem, is why our grandparents are raising our grandchildren. So there's a component there of, you may still be in contact with the parent of the child. You still love the parent of the child. You still have a relationship with the parent of the child. So when drugs are involved, there's that navigation tool. And so there's counseling, stress management in that relationship, and then in the relationship of raising the grandchild who has a parent who may be in active substance use abuse. So all of those things go together, and that's how they developed this program. We in Harrison County, first ones to implement it fully. So with grandparents, they've recognized that this is one of the fastest growing populations whose members are at risk for poor health. They're actually at risk for addiction themselves, low test scores, poor education, unemployment. Remember, we're at a time in our life where we're on the downside many times of our income if we're still working. Many times we're retired. This is a time when unexpected expenses which arise with children, accommodating that is hard. I have grandparents who are adding credit cards to their monthly bills because they have no other source of income, and so that's a last resort. And that's not good. That's not good to put them in that position when they're only trying to do the right thing. So this population is at risk for having all of those risk factors because they don't have formal, informal, or tangible resources to direct them. So Harrison County, first county in West Virginia, it was brought here by the members of the community that understand this problem. United Way is one, Harrison County Board of Education, Family Resource Network, WVU Extension, and Family Services of Marion Harrison County, who is my employer. Okay, so this PowerPoint was developed for use a couple times, and I really like it because we did it in front of the West Virginia Department of Education. They're our newest members so that we can describe the programming of it. So this is our journey. So Title I, those are the services directed to communities that have financial struggles. So Lola Brown, and if you ever get on anything with Lola Brown, stay there. She's amazing. She's a powerhouse. She's the director of Title I in Harrison County Schools. So she noticed these things happening. So, you know, second time around parents, these are things that she brought together. So this program was introduced to us by the West Virginia State University. It's grant funded, and it's a way to train people to support this population. We had to present to the key factors, or the key people in the community. So it was the assistant superintendent, the principals, community members, board members. We had to get this program in front of the people that can make things happen. And that's what they did with this group. So we had to, one of the biggest struggles we have is our identification of the grand families. And so we know that our teachers know who they are because they get to know their kids. So those, the teachers are so valuable to us in making referrals. Word of mouth. Formally, we can do grants to research out and find these families. We can do, through schools, when they register their kids, we find out where they live, or who they live with, through that mechanism. We just did a huge mailing to families that they felt, based on the information they provided, might be grandparents raising grandchildren. So, again, we were a pilot site. We followed all their guidelines to the exact way that they developed the program. Dr. Brenda Walmsley and Bonnie Dunn were the two main people that started the program at West Virginia State University. So then these are, again, the stakeholders that came to be part of the programming as we implemented it in Harrison County. As you can see, again, the superintendent, Title I supervisor, our principals in our schools, the counselors in our schools, the Parent Educator Resource Center, and then social workers. We had all these people at the table: United Way, Family Services of Marion and Harrison County, Legal Aid, invaluable, Healthy Harrison and Community Care. So these are all resources that came and helped us. So these are the critical pieces for this program. So the social worker, I go out and meet the families. I am their connection to everything else. So that's why it's, you know, it's kind of the top of the list there. Pam Hotzenpiller is our coordinator for the program. Man, she's another powerhouse. She knows everybody. She can connect me up to different resources. It's, I just love her. So we work on recruitment, making people aware of the program. We do it from a variety of ways. Pam has connections. She's got me on TV, multiple times got me in the paper media, internet media, and that has really generated some responses. And not even from grandparents, but just somebody who maybe knows somebody who might be in that position. So that's been, again, valuable. Through you guys knowing about our program, that's one of the biggest things. Amber is awesome. She will always think about healthy grand families. And that is, and being in the forefront of everybody's mind when they're talking about, or talking to somebody, again, invaluable. We have everything donated. When we have classes, we have binders. We give them, we don't create an atmosphere that they have to go out and do this and go out and do that. We want everything as easy as possible for them. So the binders, the food, daycare, all of that stuff is just provided so that when they utilize session services, they simply sit down. That's all they have, or get there and sit down. The session presenters, when Dr. Walmsley and Bonnie started this program, they went out and found the professionals and paraprofessionals that are experts in the subject matter that they talk about in each session. So each county has access to this list of experts that will come and do all of this speaking at sessions for free. So it's just a matter of, okay, we decided this spring, and this is what we're doing. In March, we're hoping to start a session. And so we contact all of our experts and say, okay, we're gonna start March 15th, and we're gonna start with stress management. And can you do it can you present this night at this time? And so we get that all set up. Pam does it ahead of time, it's amazing. So again, the meals, the child care locations and times, we hold it at Simpson Baptist Creek Church. And then the funding, we have a wonderful community that gives us meals. They donate the materials for our binder, everything. So it's seamless for us. We don't have to worry about funding for that. We just have to make it happen. So recruitment services too. We get a lot from doctors' offices, churches, other agencies. Schools, obviously, the biggest word of mouth. And then, like, I don't know, the West Virginia Works Office, which is TANF, WIC. So those are agencies that come into contact with our, population that we serve. This is our recruitment package, and you should have all gotten the flyer, but that's our brochure, and then we have a referral form that if you could refer somebody that you know personally, or just have them call me. So to date, again, since 2018, we've had 6 sessions. Last 2 years, as you all know, have really upended what we're able to offer in the session, only in the session impact. But we did just have a virtual session, which it was wonderful to be able to see people, but it was problematic with not everybody has the same internet service. So we did have challenges in that way. And also, grandparents were home with their kids. And when kids need something, they need to be fed or they need a bedtime story, that takes precedence over this class. So we did it. It was a connection. It wasn't my most favorite. So these are the session topics. Communication. Man, we've had some wonderful presenters on the way we communicate, especially with kids at different developmental ages. And I know when I raised my kids, there was a program called STEP. It was Systematic Training for Effective Parenting a long time ago. That has, what we're doing today in this communication, yeah, I wish I had that back then. But it is, it's so valuable on just simple things that we don't realize when we struggle with communicating with our kids. Parenting in the 21st century, family relationships again, when you have a child that's not in the house, but you're raising their children. So there's that family dynamic that can be excruciating because I just became a first-time grandma a couple months ago. And man, nobody told me that I would love this child the way I love this child, even though I have children. I would do anything for this child. So there's a different level of communication, reaction, all of that with a grandchild that you're not parenting. So if you put that all together, it's confusing, very, very confusing. Self-care, health literacy. Our grandparents have to take care of themselves because I don't know what happens. I mean, the kids go. Maybe there's another family member that can take them, but this is scary times. Navigating the school system, the legal system, technology, addiction, and nutrition. So I think I mentioned before when we initially did this, we had 2 locations, one in Bridgeport, one in Shinston. Yeah, we have so many businesses that just contribute. It's beautiful. I mean, it really does bring tears to your eyes that they will do this. We don't have to beg. They offer us. It's amazing. Let's see. Yeah, we have babysitters at our sessions when we hold them live for different age groups. So there's a baby room and a middle room and then maybe one for the older kids so that you can just supervise. They can watch TV or chill. So it's just fun. So we have celebrations when they graduate. We just had a Board of Education meeting Tuesday of this week, and we had one of our recent graduates attend, and then we had a celebration for some donors. So the Bridgeport Juniors women gave us $5,800, and they're still raising money for us. Thrasher Engineering gave us money. Books A Million gives us books. It's so fun. We went in Loverport Elementary on Grandparents' Day 2 days about a month ago. And so we had like 3 hours with the grandparents and the grandchildren. We did activities, and we were able to give everybody books. It was the most fun getting back into schools, and the kids loved having the grandparents there. Grandparents loved being there. So Pam Hotzenpiller is the coordinator, and she's the one that puts everything together, makes all the magic happen. She's got this, man, she's intimidating. She's got this spreadsheet of all of her action items. She checks it off, she checks it off. I don't have to do anything, which is amazing. I know I'm fortunate because other counties do not have a Pam. I don't know how they do it because that is not actually the social work aspect of it. It's more the coordination, obviously, with the title. But yeah, she's invaluable. I just love her. So this part is what I do. So the connecting with the grandparents in Cleveland is a phone call. So this is tough because can you imagine getting a phone call from somebody, and my number is from the Board of Education. That's what you see when the call comes in. And so I need to do a lot of prefacing before I dig down into what I'm calling them about. And when you're calling too, I don't know, I'm not gonna trust anybody that calls me and says, hey, this is so-and-so and I have this to offer you. I mean, honestly, I'm not. So our conversations are superficial at best in the beginning until they get to realize what I'm doing. Number one, it's free. I wanna be able to help you. Tell me, so we work on getting to know each other, and that's where our point of contact is. So I explain the project, and as you can see, I can go off tangent too, easily with this. And so I let them lead me in the conversation of how it evolves, and I mail out a ton of information. So I introduce myself, and then I sell it with all the material that goes to their home. So they at least know that I'm a legitimate person. I have a legitimate, not concern, I want to help them. So then they see that. So we've done a lot of porch visits lately. They sit there, I'm back here, and we get to know each other that way. What I found out in the year I've been doing this, the more contact I have with them, the more they feel comfortable about me and they begin to trust me. So I look at any opportunity to go out to their home and just drop things off. Brad got us a donation of turkeys, and so I made decision on the limited number, who I was going to go visit, who maybe I haven't talked to in a while. We've gotten meat donated. We've gotten Amber is wonderful with getting things directed my way. So that gives me the excuse to go out there and say, hey, I'll say with the turkeys, we had United Way donate us turkeys, so can I give you one? What's a good time? Do you need anything? Is there anything that you wish you had? I mean, we talk about that so that they get to know me. I will say, again, when we get the calls from people, they're usually in crisis. It's not a time where, I think I'll just call Healthy Grandfamilies. It's that maybe they need legal help. Maybe that they can't get the Medicaid card from the parents, and the kid needs to go to the doctor. It could be somebody ran away. It could be, this is one we get a lot. They get the kids in the middle of the night. They don't have beds. They don't have clothes, diapers, formula. They don't know what to do. So that is not a time to talk about the educational component of our program. This is a time to jump in and say, what do you need? How can I help you? So that's the majority of how I handle and how I interact with this population. So I think I talked a little bit about how I get to know the families. I struggle with this in the beginning because they want us to gather all this information. All I'm doing is asking pointed questions. We just sit down and I say, what's your origin story of how you came into, raising these grandchildren? How are you feeling? What do you need? The biggest question is, what can I do for you? What do you need? And I got almost to 100%, oh, I'm fine. I don't need anything. So, I just continually ask that. What do you need? And then they'll bring up in conversation something, and I'll say, hey, I can get some of that for you. And so then they learn what I can do. And so that's kind of building our rapport. So I will never probably get any of these forms filled out the first time we ever talk at all, because we're just getting to know each other, as it should be. It shouldn't be transactional. We have to develop a relationship. So with the data that informs our delivery of service, we're always updating that. And I think I'm kind of like COVID. The data from this period of time is going to go woo, because it's none of it is education related. It's more of resource related. What do you need? That kind of thing. And so we'll be really looking into this stuff later on. So these are some of the reasons. And reasons is kind of, I don't know if that's the best terminology, of why a grandparent is raising grandchildren. And as you can see, the top one is drug related, but I think we need to soften this in the way drug related is utilized. Because we know you can become a substance use abuser for multiple reasons. Many have underlying mental health conditions. Depression, anxiety, bipolar, those are there, and then the response is the drugs. Physical health, again. So there's all of these reasons that they could become sober, clean, straight, but they still have the other underlying conditions. So I think we just need to be cognizant of that reasoning, because it's not that somebody just became addicted and then they walked away from the kids. Financial, jail, disability, and death. So before I started in Harrison County, I was doing my field placement at Family Services, and I got to work with the Marion County group when it was active and everything. So one of the biggest things I saw, and I watched the social worker there, was sitting down while we eat dinner and checking in with each grandparent. Hey, how is, did so-and-so get her project done? So this kind of really knowing your clientele that was offered at the session, so you check it in. And then where the data comes that we derive is that before each session, we do a pre-survey. So if it's legal, you'll say, what do you know about this? What do you know about this on a scale of 1 to 10? And then after we do the class, they do a pulse survey. So that gives us an idea of, are these making a difference? Should we pivot? Or maybe we need to do more of this topic. It really informs us for the future. So this is a good example of evidence of change. We know, especially when we talk about the school session, that we see an increased use of parents in the Parent Educator Resource Center with IEP meetings, what's available. Having somebody be in your corner for your kid when you know that something extra is needed, some accommodations are needed, just something. And we like this picture. No, that's her water. So this is evidence of change. After a nutrition one, Grandma always came in with pop, soda pop. After the nutrition one, water. So that's a change. They were talking about the benefits of hydration and water. So, I mean, when you think about it, I mean, sure, that's not a big thing, but it kind of is a big thing. You know what I mean? When we're talking about health, nutrition, and wellness for our grandfamilies. So these are, when I was talking about pre and post survey, so the yellow areas are the highest changes that we saw. And again, navigating the school system, we talked about that. The legal system, oh, stress, huge, because we know this it's already stressful raising kids. Added in and age, yeah, we bump it up. And then technology and social media, which kind of makes sense. So these are just some of the comments that we heard after sessions. And since I only got to do the one session and I had 2 graduates, what I heard from both of them, and they had been grandparents for it wasn't like just recent, it had been a few years. So what they said, they wish that they had the session on education when they got the kids, because by the time they sat in on ours, they could probably teach it, because they had to become subject area experts in advocating for their grandchild. So that was really eye-opening to me about how intimidating the school system is, and how, that support, man, when your kids aren't happy, you're not happy. So all of this, interwoven together. These are some of the least favorite parts of it. Sometimes, yeah, not enough. The sessions go fast. They're not boring at all. Like I said, I've said it on. They're so informative and they're interactive too. So it allows everybody to share. I think that's a big thing too. Ways to improve it. Yeah. And again, the second one, it's, they don't always get, or it didn't start off that they were getting their grandchildren through substance abuse. So I think when we broaden that, and also soften the term addiction, that, because again, it's just not a narrow focus of why things happen and how they evolve into what they do. So after the classes, there is the social work group, or social work component, which is what I do. And so you do a plan of action. What do you see going forward? What do you need? What services can I hook you up with that are gonna, help you guys? And what we're finding now that we've been in this for a couple of years, this happens the whole time. You can't sign somebody up and say, okay, in 2 months, you're gonna do the educational component and then I'll help you. I help you from day one. It just, especially with COVID, that it totally makes sense. Why would I hold off on that service if you need something now? So again, that's the way the program was structured, because we had to see it happen. So even if you don't go through the sessions, we have a support group. It was monthly before COVID, and now we're virtual every 2 weeks. And so what I try to do is bring in speakers to talk about certain issues. Like with children that are, if they're in foster care or guardianship, it's called Modify, mentoring, there's a program in West Virginia, Modify, and it helps the kids go either tech school or college at, like funding levels that are wonderful. But nobody knows about it. Nobody understands the program. So I bring in these subject level experts to talk about it. Always, because if you've got a 9-year-old, you're kind of not thinking about college yet, but you should be. There's also programs available for kids who have disabilities. So just bring in, the foster care ombudsman group. It's a new group that it's like the inspector office at the state level. But if I have a grandmother or grandfather who is having difficulty with a CPS worker, I involve them. They will open a case up and we will advocate for the grandparent. So, they're wonderful. They listen, they open a case up, and then I'm out of it, because I shouldn't be involved. You just go off the works when you have too many people involved, but they're fantastic. And we have a Facebook group. You know, they're not my favorite. The group, Facebook is not my favorite, but this is what everybody, you know, meeting them where they're at. So that's how we do a lot of communication. This was awesome this year. We finally got to do it this year. So it's a fair that we had 50 agencies that had every aspect of dealing with children. I think, have you guys heard of Sleep Heavenly? Sleep in Heaven? They built beds. Yeah, so they were there with the miniature bed. But just those types of agencies that there are out there, and even though I may know of them, they're not at the top of my head. When we have these events, it reminds me, oh yeah, and then I can remember who needed that.